Do you have any tips for me about how I can get my child to sleep through the night without wetting themselves? I see a lot of children with nocturnal enuresis. That means wetting at night. 10% of 5-year-olds are wet at night and 5% of 10-year-olds are wet at night. And it nearly always follows a family history. And often it doesn't matter how many things we can do to intervene, often they will remain wet until whatever the genetics that's caused this stop. So if the father was wet at night till he was 8 or 9, it's very likely their child will be exactly the same. There are some things that we can do to help, and you can absolutely try them at home. Some of them are medication, which means you'll need to go to your GP or to see a paediatrician or a bladder and bowel service in the community. So don't give your child a drink for at least 3-4 hours before they go to bed, so that at least they've, and make sure before they go to bed they empty their bladder. Make sure there's a light on in the bathroom, so if they want to get up in the night to do a pee, they can do that. Sometimes parents will lift their children. So say the child goes to bed at 8 o'clock or 9 o'clock and the parent goes to bed at 11 or 12, they'll go into the child's bedroom, they'll lift them up and they'll take them to the toilet. Lots of parents say this works. I'm not completely convinced, but it's certainly worth a try. And if it helps, that is great. The next thing you can do is you can try a bell and alarm. So these are available, you can buy them online, and they're a little sensor that goes inside your child's pants, and they're very, very safe. And as soon as the child starts passing urine, it rings a bell and the child wakes up and then trots off to the toilet. My experience of these is that it can be very tricky, because often the bell wakes up everybody else in the family and not the child, which is probably one of the reasons the child does wet the bed. They may be very heavy sleepers. So that can be a bit of a problem. And certainly I was taught by one of my colleagues that you're much better off doing all these things together. So not only you have the drink early in the, not too late in the evening, you lift them, you make them go to the toilet, you have lights on, you have the bell and alarm, but also you try a medication called desmopressin. That's very safe. It's available as a melt under the tongue, as a tablet, and also a nasal spray. So it's very available, it's pretty safe. You need to get a prescription for it. And often people feel that if you do all 3 of those together, that may well help. So these are some ways that I manage children with nocturnal enuresis in clinic. The desmopressin needs to be prescribed, but the other things you can certainly try for yourself. And if you find that you think that having a prescription may help, certainly for sleepovers, for instance, then please go and seek medical attention, because this medication is very, very much available and very safe. If you found this video helpful, please follow me on YouTube and let your friends know.